Welcome back. We're discussing the current political battle over the US healthcare system and looking at the debate over whether or not the country should implement some kind of government-run health plan. Joining me are former British Health Minister Lord Aradarzi of Denham. Dr. Tevi Troy served as the Deputy Secretary at the US Department of Health and Human Services under President George W. Bush. And we also have Canadian Member of Parliament Ujjal Dosanjh, who previously held the post of Canada's Health Minister. Let's get back to our questions. And here in Washington, D.C., Dr. Troy, a live station comment from our live station chat room where it's taking place. Corin in Poland's asking or saying, with public health care, you get poor quality, the healthy pay for the sick, long queues and lack of competition between hospitals.
Well, he's got a really good point. I mean, there's a lot more innovation in the U.S. system because of competition. Hospitals have to make themselves better in order to do a better job and attract more patients because they're often money-making institutions. In addition, we have a lot more medical innovation taking place in the U.S. Something like 75% of new pharmaceuticals introduced between 2005 and 2007 were initially introduced in the U.S. So there's more innovation taking place in the U.S. because they know there's incentives to get profits with it.
But apparently there are like 6 healthcare lobbyists for each member of Congress, which kind of makes me wonder who runs the healthcare system here.
Right. Well, I think that's a problem. I think there are a lot of lobbyists per member of Congress, and that, I think, when you have more government involvement, or when you have this hybrid system that we have, and the Medicare system, for example, covers 40 million elderly people, and Medicaid covers about 40 million poor people, and the prices are determined by those systems, and the lobbyists, in many cases, are working to influence those systems, and so I think that's what encourages more lobbying.
Lord Darzi, we had a viewer from Ireland who wrote into our Facebook page with a comment. Hassan Jamil in Cork wrote in saying, "There is not a country that can match the task Britain has taken of providing free healthcare. It's a landmark which only few shall achieve." A fan there of the NHS, of course, but yet in Britain it seems more and more people are being pushed towards getting private insurance. So how long can the National Health Service survive in its current form?
Well, I must say, again, back to the debate about private insurance. If you look at the data and the information available to us over the last 5 years since the reforms took place and the waiting times dropped and the access improved, in actual fact, the percentage of patients seeking private health care, which used to be historically about 10%, is reducing because the access, quality and efficiency has improved. You have to remember, over the last decade, we've increased the funding in the NHS from what it used to be about 43 billion to near enough 110 billion pounds. And that has been a significant growth. We strongly believe that we have a system, as you provide care from the cradle to the grave, the incentives are more aligned into prevention, and that has been part of the reforms that I have been involved in over the last 2 years, and certainly improving quality. We talk about innovation, that word has been used earlier. The innovation in any other sector is usually introduced because it improves quality and reduces cost. We strongly believe in innovation, but it's quite important to, again, put it in context that one of the biggest problems in the American healthcare system is increasing costs. Right. Without necessarily improving the life expectancy of an American. Our system, the life expectancy is 79 years, in the US is 78 years, and US spends twice as much as our GDP, percentage of GDP in healthcare.
Now, Mr. Dosanjh, if I could get a question to you that came from our live station chat room here from George in the USA. He's writing in there saying, does Canada's healthcare system use any for-profit companies?
The hospital care is all publicly funded. There is no room for private hospitals to operate in Canada. Sometimes day procedures for day patients, some of them they are provided by medical practitioners, but they're not covered. You have to pay privately, and there are very few of those, like cataracts and the like. I would say 98% of the healthcare in Canada is provided and publicly funded. Of course, the other issue of the pharmacare plans, the drugs, is an important one, and many of the provinces have pharmacare plans. We don't have a national pharmacare plan. We were working on it when I was the Minister of Health. That work has been abandoned, but I think we will, over the next 3 or 4 years, perhaps, if the government changes, we may work towards the national pharmacare plans, because a significant amount of the money that's spent in healthcare is spent on drugs. and we provide the medicines and the drugs when someone is hospitalized, but when you're at home recuperating or otherwise, you have to pay for your own drugs. And of course employers have extended health benefits and the like, but there is no national plan per se.
But Dr. Troy, it's ironic President Obama went in with great intentions, healthcare for all, you know, some kind of sense of security for people, and yet it's the one issue that's severely hurt his ratings in the polls.
Well, look, President Obama rightly said that the costs are too high. He also said we don't have enough access. But he is trying to increase access and reduce costs, and I don't think you can do those two things at the same time. And I think by setting that unreachable goal, I think that's what's hurt him.
And yet Britain spends so much less of its GDP on healthcare, but provides a greater level of coverage. So there must be a system to be more efficient.
Well, I certainly agree that we need to have more efficiency in the U.S., but you can't necessarily look just at life expectancy, for example, as Lord Darzi mentioned. Unfortunately, in the U.S., we have a lot of traffic fatalities and a higher homicide rate. I mean, that contributes to lower life expectancy. It's not just about healthcare outcomes.
Can anything be done to take on the kind of strange haggling that takes place between the insurance companies and the healthcare providers? I have a friend whose father had a heart attack while visiting the US, and his one-night stay was billed at $60,000, $10,000 for the room, dollars, $1,000 when they broke it down, $1,000 for his bathrobe, and like $5 for swabs and things. I mean, this is it's kind of strange.
Yeah, you're getting at the issue of cross-subsidization. What we have in the US is an odd system where the privately insured individuals are basically subsidizing the publicly insured and the uninsured people. And it would be better if we could have a system where everybody's insured so you don't have that kind of cross-subsidization. But hospitals make a profit on the privately insured people. That's why they charge them so much.
Lord Darzi, there was another viewer who wrote in with a tweet through Twitter who sent this. It's from Oktay Hussaini in London, who says, "At times the NHS can be frustrating, but it's a truly remarkable institution that provides healthcare for all, irrelevant of class." Is it effectively truly class-free? There are those who say, of course, they can buy better services when they have the money.
Well, I could reassure you, it's not just class-free, it is age-free, it is sex-free, it is free at the point of need. You know, I go to work, I treat my patients, I don't ask them whether they have cover or they don't have cover. We just get on with it. And as I said earlier, you know, it's part of what we do every day in life. You know, the expectations of it's a right here. It's a right from the day you are born, and something we're very proud of.
Now, sir, does your goal, because you are highly respected in your position when you're in government for focusing so heavily on delivery of quality of service, did that match the goals of the government, which Gordon Brown's government seemed very much focused on targets and performance-related issues that perhaps might have contradicted what you were trying to do?
No, I don't believe so. I mean, as I said, we've been through a 10-year of reform. You know, our system back in the mid-80s, early 90s, and where it is now, you know, there's been a huge build in the infrastructure, the investment. This is taxpayers' money. We really had to set what we call the standards in the NHS because, you know, some of the viewers were right. You know, 10 years ago, some of my patients could be waiting for up to 18 months for their elective procedure. We've invested in infrastructure and resource. My part of the reform, which is the last 2 or 3 years, is to focus to what really matters now to patients and clinicians, which is the quality of care we provide. That is what brings me to work. That is what my patients expect from me. So, you know, I came towards the latter part of reform, focusing on transforming quantity into quality. And that's why we've captured the imagination, certainly, of many, many of the users of the service. And that is why, if you look at the public or patient satisfaction surveys of the NHS, 93% of the users of the NHS think very, very highly of the service they receive.
Right. Well, gentlemen, unfortunately, there's so many more questions, and of course, we hopefully will get to revisit this. But I thank you all for your input. Thank you very much for those excellent perspectives.
Thank you.
And thank you for being with us on the next show. Wasting food. Could what you throw away feed the hungry person next door? We look at the challenges of getting food to those who really need it in the developed and developing worlds. Now, don't forget, you can follow me and get updates on the topics we cover here on the show via Twitter. Just tweet us your questions and comments. We'll try to feature them in the show. That's it from me and the team. We'll see you next time.